This is Biomechanics Module 3. The topics are levers and generating movement. The first topic then is levers, and levers are used to convert force into rotation. So we have a lever consists of two forces, two moment arms, and an axis of rotation. And levers are really the way that our internal forces, muscle, balance external forces, typically gravity and the ground, and create motion. So they're really important to understand in terms of human motion. A moment arm is the distance between this axis of rotation on top of the fulcrum here. Axis of rotation, the moment arm is the distance between that axis and the applied load. So there are two moment arms here on each of these levers. And we have three different types of levers, class 1, class 2, class 3, that we will talk about. A mechanical advantage is an important concept to consider, and it's really about how easily or how effectively we can move a load based on primarily the length of the moment arm. So if we have a really long moment arm, we can move a really heavy load because it gives us a mechanical advantage. So this picture shows a large load, but it's fairly close to the axis of rotation, so there's a shorter moment arm. The effort is applied way out distally on this lever, and then so we've got a much longer moment arm, and that gives us a mechanical advantage. If you go back to that equation I just talked about in Module 2, torque is equal to force times the moment arm. So if we have a long moment arm, we can move a lot of mass on the other side of the lever. So class 1, those are typically pretty well balanced levers, and the mechanical advantage is kind of mostly equal to 1, basically. For a class 2, this is an unbalanced lever because the effort force is further from the axis. So we get a longer moment arm for the effort, or the external, for the muscle force, if I'm saying that right. So we have a mechanical advantage that's greater than 1. So this is a very effective and efficient class lever, class 2. Class 3 is also unbalanced. In this case, the effort is closer to the axis, so we have a shorter moment arm, and that's inefficient. So our mechanical advantage is less than 1 in this case. Unfortunately, the body is mostly class 3 levers, so it's not very effective in producing huge amounts of torque. It's more effective at creating joint excursion. So we get a lot of range of motion at the expense of generating a lot of torque. So here are some examples of levers in the body. Class 1 lever, first class lever. The typical example is the head on top of the neck, the mass in the front of the head. Okay, let's talk about the axis first. The axis of rotation is the sitting on top of the first cervical vertebrae, the head resting on top of that. The mass of the front of the head is greater than the mass on the back of the head. So it wants to create a rotation where our chin drops to our chest, right? So then we've got muscle effort. The muscles on the back of our head that attach on the back of the head are pulling downward to create a balanced class 1 lever in this case. So that's a typical example of a class 1 lever in the body. The best example of a class 2, and maybe the only one, is the gastroc soleus at the first metatarsophalangeal joint. That's our axis of rotation. And then our body weight is acting between those two, right? So we've got our body weight mass, our body mass is coming down. It's closer to the axis of rotation. Our gastrocsoleus complex is acting on the calcaneus behind the axis of rotation, or the here, and it's a longer moment arm. So we get a much more efficient mechanical advantage here with this class 2 lever. We can compare that to a wheelbarrow. You can lift a lot of load with a wheelbarrow because it's a class 2 lever and our effort is further away from the axis of rotation. And then third, most of the joints in the body are composed of a class 3 lever where the effort is attached pretty close to the axis of rotation, in this case the elbow joint, and then the load is further away, so that has a mechanical advantage. The external forces have a mechanical advantage. So this is, again, ineffective for creating a lot of torque at the elbow, but very effective at creating range of motion. So, kind of hinted at this on maybe the first or the second slide, but muscles are attached to bones, usually through a tendon, and when they generate a force, they contract, they shorten, right? You can't push a rope, you can't push a muscle, but you can pull. That's an internal force acting at a point of application where that muscle inserts. Usually there's a short moment arm. We call that the internal moment arm. And then the segment that we're moving, in the last picture it was the forearm, when we're trying to move that segment, that has a center of mass and gravity is acting on that segment. That's the external force. And at the point of application of gravity acting on that external, on that segment, acts in a downward direction, and it's applied at the center of mass or the center of gravity. So we can create an external moment arm for that as well. So how does motion work, right? This is a snapshot of elbow flexion, frozen at about 110 degrees maybe, right? So our biceps is the muscle that's creating this flexion motion, and we could draw an internal force vector here on the muscle. Oops, I didn't draw that very straight. And that doesn't look very good because it's red on red. Okay, so that's my muscle force vector. My internal moment arm is the perpendicular distance from the axis of rotation, which is represented by this dot. That's my internal moment arm. So my force times my moment arm is going to result in some type of torque that's creating elbow flexion. I could draw that torque as an arrow in that direction. It's creating elbow flexion. My muscle activity is here. Shortening muscle. That's important. Shortening muscle. Okay. The external system, let's just draw that in green for fun. Let's put our center of mass here. Same axis of rotation. Gravity's acting in a direction that's straight inferior, and my external moment arm is here. So my external moment arm is at least twice as long as my internal moment arm. Gravity acts at a certain amount of, accelerates the arm at a certain magnitude. So we could figure out the force that's being created here. And we can do some math to balance this system out where it's frozen in time at 110 degrees. We could set one torque equal to another torque because there's no motion. It's called static equilibrium. But what we would find is that let's just say this muscle moment arm is half the length of the gravity moment arm. If you think about the math, torque equals force times moment arm, that means we need twice as much muscle force as we do gravitational force to stay in static equilibrium, right? Because this is 2 times longer than this, so the muscle force has got to be 2 times greater than the gravity force. Now, if, let's see what the next slide says. Yeah, torque battles. Okay, so if we wanted if we wanted the muscle to win the torque battle, remember what we just said was that we're stopped at 110. There's no motion happening. Those two torques are equal. If we want to keep going into more and more flexion, that means we have to generate more muscle force, right? Because that internal moment arm isn't going to change appreciably. It's sort of fixed based on where the muscle attaches. So we need to increase the muscle force so that we can bring the elbow into full flexion. Or if we want to let gravity win and return to a position of elbow extension, we would back off the amount of muscle force we're using, and that would decrease the internal torque, and it would let the external torque win. So I like to joke about this like being a torque battle. Which one's going to win? Do we apply more muscle force, or do we back off the muscle force and let gravity win? So motion, anytime motion is happening, one of those two is winning the torque battle. Maybe ground reaction force, as it gets more complex, we can add that in as well, because that would contribute to the torque battles as well. But in a simplified version, we've got the internal muscle force versus gravity acting on the segment, and that's our battle. And we got to figure out who's winning and who's not, and think about it in terms of motion. Why do we care? Well, for this, first of all, we're PTs. We have to understand this. This is really important in how people move and why the quality of their motion may or may not be good. There's a whole bunch of reasons why it's important. For this particular class, Foundations of Clinical Biomechanics, we're going to teach you about manual muscle testing. Manual muscle testing is a torque battle. We're going to ask people to produce maximum muscle force, and we're going to try to push them in the other direction. In this case, this is the PT, and he's asking this patient to hold his arm at 90 degrees of flexion, and he's trying to push it down. So he's creating a torque battle here between shoulder flexion and shoulder extension. And we use that concept to understand if a patient is strong enough to win the torque battle, basically, or balance it, because we don't want to see any motion. We want to see it in static equilibrium. So it's really important that we understand how you understand the torque equation, we understand why it is we do these tests, why we apply our pressure here at the elbow instead of out at the hand. Hopefully, maybe we'll talk about that in class. So it is important. So for strength testing, if you change where you apply your application of your force every time you test a patient, sometimes it's above the elbow, sometimes it's below the elbow, sometimes it's at his hand, you're going to get different output, right? So we want to be really reliable with how we test. We've got to think about the point of application. We've got to think about how hard we're pushing. Are we going to use maximum force, or are we going to use less than maximum force? If you think about testing strength of a finger, you probably don't need maximum force. Well, you got to figure out how do I know if I'm using a similar amount of force or not? And then direction. Am I pushing the joint in the right direction, or pushing the segment in the right direction to do the test properly, or is my direction off? And that's going to impact your test because it changes the moment arm. Patient variables. The joint position, the muscle length, those things can change how much force the muscle can generate. Can the patient follow directions accurately? Are they giving their best effort? Those things can also interfere with the interpretation. So we want to be consistent when we do muscle testing in our technique and in our messaging to our patients.